السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم. I'm إيمان العزب, Professor of Anatomy, Faculty of Medicine, Alexandria University. معكم إيمان العزب, أستاذ التشريح كلية الطب جامعة اسكندرية. In this video, I'll talk about the anatomy of tarsal canal and tarsal sinus. As regards their boundaries, content, ligament present inside, and the attachment and function of these ligaments. To start with, what are the compartments of subtalar region or talotarsal region? The subtalar region is composed of anterior, middle, and posterior articular facet between the inferior aspect of talus and dorsal aspect of calcaneal. The anterior compartment consists of talocalcaneal joint, single joint, characterized as synovial, polyaxial, ball and socket in type. The talar head, which is the ball, articulate anteriorly with the posterior surface of navicular bone and is supported inferiorly by the anterior, middle, articulating facet of the calcaneus and spring ligament or plantar calcaneonavicular ligament, forming the so-called acetabulum pedis or the socket for this joint. The middle compartment is the tarsal canal and tarsal sinus. The posterior compartment is the posterior subtalar joint. This photograph demonstrates the three compartments of the subtalar region. This is a plantar view of right talus, and this is a dorsal view of right calcaneus. The green colored area represents the anterior compartment, consists of anterior and middle articular facet present on the inferior aspect head talus. Articulate with corresponding facet on the dorsal aspect of calcaneus. Anterior facet, middle facet. The middle facet is present on the dorsal aspect of sus-tentaculum tali of calcaneus. This medial projection is called sus-tentaculum tali. The middle compartment, which is violet in color, consists of tarsal canal and tarsal sinus. The medial end of tarsal canal lie at the posterior margin of sus-tentaculum tali. Tarsal canal expand laterally to form tarsal sinus. The posterior compartment, which is red in color, consists of one articular facet on the plantar aspect talus, which is called the posterior articular facet, articulate with corresponding facet on the dorsal aspect calcaneus, form subtalar joint or posterior subtalar joint. The middle compartment of the subtalar region consists of narrow posteromedial tarsal canal and wider anterolateral tarsal sinus that separate the talocalcaneonavicular joint anteriorly from the posterior subtalar joint posteriorly. The narrow stem-like tarsal canal extend medially posterior to the sus-tentaculum tali. The long axis of the tarsal canal and tarsal sinus is obliquely oriented at an angle of 45 from posteromedial to anterolateral. The dimension of tarsal canal are from 10 to 15 mm height, 3 to 5 mm width, and from 15 to 20 mm long. This photograph demonstrates the funnel-shaped middle compartment of the subtalar region. The narrow part is the tarsal canal and the wide part is the tarsal sinus. This is the anterior middle articular facet on the inferior surface head talus, articulate with corresponding area on the dorsal aspect calcaneus, and this is the posterior facet. And as you see, the tarsal canal and tarsal sinus separate the anterior compartment from the posterior compartment. The left photograph delineates the funnel-shaped middle compartment of the subtalar region. The narrow part is tarsal canal, the wide part is tarsal sinus. This middle compartment separates the anterior from the posterior compartment. The left photograph delineates the wide lateral opening of tarsal sinus in articulated talus and calcaneus. This is the head talus, this is the neck, this is the body, and this is a triangular articular facet. So this is the lateral view for talus and calcaneus, and this is the wide lateral opening of tarsal sinus. The tarsal canal and the sinus is the middle compartment of the subtalar region. It is a conical or funnel-shaped interosseous tunnel created in articulated talus and calcaneus and formed by the concave surface of talus, which is called the sulcus tali, and concave surface of calcaneus, which is called the sulcus calcanei. From a lateral view of subtalar joint, the sinus tarsi is observed, a cone-shaped structure that contain fatty tissue, blood vessel, and talocalcaneal interosseous ligament. The sinus tarsi has a wide opening at its lateral part and a narrow opening medially, which extend as the tarsal canal, which has a small medial exit. The tarsal canal and sinus contain complex system of ligament, arteries and their anastomosis, artery of tarsal sinus anastomosing with artery of tarsal canal, adipose tissue, joint capsule, nerve fiber from superficial and deep peroneal nerve, and posterior tibial nerve. The sinus tarsi space is filled with connective and fatty tissue that contribute to the stability and overall proprioception of the ankle. This connective and fatty tissue serves as a substrate for numerous mechanoreceptors and free nerve endings that, along with ligament and muscles, provide nociceptive and proprioceptive information about foot and ankle movement. Dorsal view of right foot skeleton. The talus is retracted medially, exposing the compartment of the subtalar region. This is the anterior compartment, this is the middle, and this is the posterior. The narrow tarsal canal and wide tarsal sinus contain 4 ligaments. The most posterior ligament is called anterior capsular ligament, which is just thickening of the capsule of the subtalar joint. Then anterior to it, interosseous talocalcaneal ligament. Then cervical ligament. The 4th ligament is called the root of the stem of inferior extensor retinaculum. These are the ligaments present in the tarsal canal and sinus, arranged from posterior to anterior, anterior capsular ligament, the most posterior, interosseous talocalcaneal ligament, root of stem of inferior extensor retinaculum, and then cervical ligament, which is the most anterior one. The cervical ligament and the interosseous ligament form a strong crocheted bond that firmly stabilize the subtalar joint. They are described as the cruciate ligament of the subtalar joint, as they overlap each other within the sinus tarsi. They are the main stabilizing ligament of the subtalar joint. Recent study stated that interosseous talocalcaneal ligament play the major role in stability of talus, not only for the subtalar joint, but also for ankle joint, especially in the sagittal plane. Being a strong and thick ligament, the interosseous talocalcaneal ligament is rarely injured alone. However, a sudden deceleration of talus compared to the calcaneus with the foot in maximal plantar flexion may cause an injury of the interosseous talocalcaneal ligament. The cervical ligament, being laterally located, it resists excessive inversion of the subtalar joint, while the interosseous talocalcaneal ligament resists eversion of the subtalar joint. Then I'll start discussing each ligament separately. To start with anterior capsular ligament. It is a thickening of the anterior capsule of the posterior subtalar joint. Rectangular band, relatively vertical in orientation, situated in the sinus tarsi, lateral and just posterior to the interosseous talocalcaneal ligament. It may extend to the tarsal canal. It extends from anterolateral surface of neck talus to the sulcus calcaneae of calcaneus. This is dorsal view of calcaneus, and this is the talus, cut part of talus to demonstrate the sinus tarsi and tarsal canal. This is the rectangular band of anterior capsular ligament from sulcus calcaneae to anterolateral surface of neck talus. It is best seen from lateral view. It stands in inversion and the anterior drawer of calcaneus. This is lateral view of the subtalar joint, and this is the anterior capsular ligament, which is best seen from lateral view. Then interosseous talocalcaneal ligament. It is a fibrous, broad, flat, thick, bilaminar ligament that span the whole length of tarsal canal and slightly extend laterally to tarsal sinus and situated just anterior to the anterior capsular ligament of the posterior subtalar joint. This is dorsal view of calcaneus, demonstrating the attachment of interosseous talocalcaneal ligament, mostly in the tarsal canal and slightly extend to tarsal sinus. This is a dorsal view of calcaneus and talus articulating with calcaneus. Part of the talus is cut to demonstrate the interosseous talocalcaneal ligament. The interosseous talocalcaneal ligament is one of the two main stabilizing ligaments of the subtalar joint with cervical ligament. It attached to the sulcus tali and sulcus calcaneae. The primary role of this ligament in the subtalar joint is maintaining stability both at rest and during active movement. Its medial fiber are taut in eversion. That's to say, it resists eversion of the subtalar joint. It consists of two bands, short vertical one, which is the posterior one, in the center of the tarsal sinus and intimately adherent to the anterior capsular ligament of the subtalar joint. The other band is longer oblique one, which is the anterior band, attached to the sulcus tali more medially. That's to say, it is directed upward and medially from calcaneus to talus. So it is V-shaped, the stem of which is attached to the calcaneus. A diagrammatic illustration of the subtalar region. In sagittal section, three ligaments appear in the tarsal canal and sinus, arranged from posterior to anterior, anterior capsular ligament, then interosseous ligament, then cervical ligament. In coronal section, the anterior capsular ligament appear vertical in direction, interosseous ligament oblique in direction. The stem of inferior extensor retinaculum has three roots which are contained inside the tarsal sinus. A diagrammatic illustration of the subtalar region, sagittal section, lateral view. This is the fibula, and this is the calcaneus, calcaneofibular ligament. This is the tarsal sinus, interosseous ligament, cervical ligament, and as you see, the interosseous ligament is posterior to cervical ligament inside the tarsal sinus. In coronal section, again this is the fibula, calcaneus, calcaneofibular ligament. The interosseous ligament consist of two bands. This is the vertical band and this is the oblique band. The vertical band is lateral to the oblique one. The third ligament present in the tarsal sinus is the roots of the stem of inferior extensor retinaculum. This stem acts as a sling retaining the tendon of extensor digitorum longus and peroneus tertius muscle against talus and calcaneus. This ligament has 3 roots: lateral, intermediate, and medial. The lateral root is superficial, originating laterally in the sinus tarsi. The intermediate root arises in the sinus tarsi just posterior in relation to the origin of cervical ligament. The medial root has 3 components: 2 calcaneal and 1 talar. That's to say, 2 roots attached to the calcaneus and 1 root attached to the talus. The talar root ascend upward and medially against the lateral aspect of the talar neck. These 3 root components combine to complete the sling for extensor digitorum longus and peroneus tertius tendon. Diagrammatic illustration of dorsal surface of calcaneus demonstrating the attachment of ligament in the tarsal canal and tarsal sinus. This is the interosseous ligament. The 3 roots of stem of inferior extensor retinaculum. This is the attachment of cervical ligament. And as you see, the stem of inferior extensor retinaculum roots are attached to the calcaneus in between cervical ligament anterior to them and interosseous ligament posterior to them. In coronal section, this is the cervical ligament, this is the interosseous ligament, and these are the 3 roots of stem of inferior extensor retinaculum: the lateral root, intermediate root, and medial root, which has 3 components: 1 component attached to talus and 2 components attached to calcaneus. The attachment of the 3 roots of the stem of inferior extensor retinaculum: the lateral root to the lateral surface calcaneus, intermediate root to the superior surface calcaneus, medial and posterior to cervical ligament, medial root to the anterior part of sulcus calcaneae. This is a dorsal view of calcaneus showing ligament attached to the tarsal canal and sinus, interosseous ligament, cervical ligament, medial root of stem, intermediate root, and lateral root. Diagram of the subtalar region. In sagittal section, this is the vertical and oblique band of interosseous ligament. This is the cervical ligament, and as you see, cervical ligament is anterior to interosseous ligament. In coronal section, this is the vertical band and oblique band of interosseous ligament. Notice that the oblique band is medial to the vertical band. The 3 roots of a stem of inferior extensor retinaculum. The medial root cross the sinus tarsi anterior to the interosseous ligament and posterior to the cervical ligament. The 4th ligament present in the tarsal sinus is a cervical ligament or anterior talocalcaneal ligament. It is a very strong broad band with striated appearance that run obliquely at about 45-degree angle through the tarsal sinus, with the proximal attachment, which is the lateral attachment, to the superior surface calcaneus, medial to the attachment of extensor digitorum brevis muscle, and distal attachment, which is the medial attachment, to the infrolateral tubercle of neck talus. So this ligament attached from superior surface calcaneus, medial to the attachment of inferior extensor retinaculum, to the neck talus, infrolateral tubercle. It occupies the lateral or anterior end of tarsal sinus, just anterior to the interosseous talocalcaneal ligament. It is taught in inversion, so it resists inversion. This is dorsal view of calcaneus showing the attachment of cervical ligament medial to the attachment of extensor digitorum brevis muscle and anterior to the attachment of intermediate root of stem of inferior extensor retinaculum. Dorsal view of right subtalar region showing the cervical ligament. The proximal and lateral attachment to the superior surface calcaneus, medial to the attachment of extensor digitorum brevis muscle. The distal and medial attachment to the infralateral tubercle of the neck talus. And as you see, this is the interosseous talocalcaneal ligament, which span the whole length of the tarsal canal and extend to tarsal sinus. As you see, cervical ligament is anterior to interosseous ligament. Coronal section of the tarsal sinus demonstrating the interosseous ligament, cervical ligament, and the three roots of the stem of inferior extensor retinaculum. And as you see, the medial root cross the tarsal sinus from lateral to medial to be attached to talus and attached to the superior surface calcaneus. Dorsal view of right calcaneus showing the ligament present in the tarsal canal and sinus. From posterior to anterior, the anterior capsular ligament, interosseous ligament, the three roots of stem of inferior extensor retinaculum, medial, intermediate, and lateral root, and cervical ligament. Tarsal sinus syndrome. It is characterized by persistent anterolateral ankle pain, usually as a result of traumatic injuries of ankle or overuse, such as repetitive standing or walking. The subtalar ligaments are frequently torn in individuals with tarsal sinus syndrome. Recent discussion of sinus tarsi syndrome describe this entity as primarily an instability of the subtalar joint due to ligamentous injuries that result in synovitis and infiltrations of fibrotic tissue into the sinus tarsi space. It mainly occurs after a traumatic lateral ankle sprain or multiple ankle sprain, mostly due to a weak anterior talofibular ligament, which lead to injuries of the interosseous and cervical ligament. It may occur due to compression injury. For example, people who have flat or pronated feet. The talus and calcaneus are pressed together as a result of this deformation. This causes bone-to-bone contact of the talus and calcaneus with inflammation or arthritis in the tarsal sinus. If you have any question, leave the question in the comment below the video. لو في أي سؤال اكتب السؤال في تعليق تحت الفيديو. Thank you for watching and السلام عليكم ورحمة الله وبركاته.